Welcome back. And here in Module 9, we'll be talking about EHR, or Electronic Health Record. In the Electronic Health Record, previously, when you worked for someone else, you just walked in and they said, this is the system that you use and you love it or you hate it, and it was your life. Well, as an entrepreneur, as an a direct primary care practice owner, you get a say in selecting your EHR. So in selecting an EHR, I want you to do this. Let's start with our service list. What are we going to be offering? So we know that we're doing direct primary care. We know that that's a membership model. So we need something that will manage our memberships, because we want to provide quality care. We don't want to do like we used to do in the old model where we got to check the boxes, and it's all about checking the boxes and doing the notes and making your life miserable so that you do not like that the care you're providing. You no longer are in love with practicing medicine because it's all about checking boxes. So we want an electronic health record that makes life easy. It makes the flow of life and providing care. We want it to be easy. So when we consider, or we're dating and courting these electronic health records, we want one that serves our needs and the needs of our clients. So we need to manage our memberships. We need to collect our payments. So some payments will be reoccurring, like your monthly membership, but you also will be offering some cash services, some cash components. So you need a point of sale. Someone comes in and they want to buy prescriptions at, that discounted prescription that you offer. You need a way of collecting that payment. You also may, if you're going to be doing some medication, distribution from your office, you need to have inventory. You want to manage your inventory. What do you even have in stock? You may want to print labels. You will be doing telehealth visits or messaging with your patients. So you want an electronic health record that offers all of those services. When you're considering who you're going to go with, about your workflow. What does your workflow look like from the front door to checkout? How does that flow? So you want to do like little dry runs in your head before you select an electronic health record, because you want one that makes that process easy. So here at the front desk, prior even getting to the front desk, someone has to answer the phone and make the appointment. Well, remember, my mom, Miss Brenda's doing that, and Miss Brenda is remote. So when we selected an electronic medical record, I needed one that could be here, that works for me, but also Miss Brenda would have access to. So we can't be on an old school network where we're, here in one place. So we needed one that was cloud-based. We also need something that, the front desk person is checking you in, so that person needs to be able to see it. But also the person in the back, my nurse, needs to know that you're here. I need to know who's on the schedule. Who am I about to go see, so that I can be prepared to go see them. So all those things are to be considered. So the person's here for a lab review. Have the labs come in? Are the labs already in the chart, or do I need to print them? Is the imaging, is the x-ray, the ultrasound, the CT scan, is it in the chart? All of that workflow, you want to select an electronic health record that works with what you're doing. Or is the person here for Botox? And have they signed their consent forms? Or they're here for a weight management consult? Does this person have a history of thyroid cancer? We know that that is a deterrent for doing some of the GLP-1 medications. So we want to have already addressed that. So you want an electronic health record that will allow you to have an easy flow, that will allow you to have access to all your patients' information at your fingertips, and also easy communication. So there's several, and honey, they will demo you until your head pops off. A few that have worked really, really well, that were designed specifically for direct primary care, is Elation Health, Atlas MD, Direct Care Note, and that one's free. Med Charts with a Z, it's also free. Sigma MD, Hint All-in-One. These are just to name a few. None of them am I married to. I personally use Elation Health. I love Elation Health. That's who we've had from the beginning, and it works really well because for my flow process, if I'm at home and because my patients get my phone number, they send me a text, say, Amanda, I've got a UTI. Can you send me something over to your pharmacy? Sure. I just log into Elation and there's an app, log into Elation, pull up that patient's chart. Oh, okay, he's allergic to or she's allergic to this, that, and the other. Their preferred pharmacy is, I type in, the medication, Cipro, it's click send, and I'm putting my phone down and sending them a text back. Medication's been sent. That works well for us. Also remember, my mom's not here. She's in Miami. And so she is able to schedule someone, or if she needs to call me, she and I can look at the same thing. She's like, Amanda, this person's scheduled for a lab review, but I don't see the labs on the chart. Do you want me to cancel their lab review and call them to make sure they get their labs drawn? Yes, ma'am. All of that's at our fingertips with this one. So something to consider is, does the electronic medical record that you're sitting down demoing, does it integrate with labs? Now, if you're not going to draw labs, who cares? It doesn't need to. But if you're going to be doing primary care, you probably want your labs. You want to be able to send your lab orders, and you want to be able to receive your reports back in an easy process. You don't want old school paper. Remember, we're trying to be a paperless society for the most part. So you want your orders to go out. You want your results to flow back in, and not in a process where, okay, on the fax is the order, and then your staff has to scan that into the thing or put it on your chart on your desk in a paper. What year is this, honey? It's 2024 at the filming of this, course. So we want it to be seamless. It's about convenience. It's about being cutting edge. That's what we're offering in direct primary care. Also, does it integrate with the imaging centers? You want to be able to send, as a part of my new patient workup, I send you for a chest x-ray. I want to be able to send that chest x-ray over to Simon Med. I want, as soon as the x-ray is done, I want Simon Med to send me a report back, and I want it in the chart. So if the patient calls me and I'm at home or I'm on 285, I want to be able to pull over, log in. Oh yeah, it does say you have a lung nodule. Woo, child, we need to address that. I want that at my fingertips. So when you're considering electronic medical record, does it do what you need it to do? And is it easy? Is it seamless? Or are there a bunch of cumbersome boxes and clicks? And do you have to go out of this screen and that screen? You want to consider all those things. Consents. Does it allow you to sign electronically, or will you have to print everything and sign it? Does it allow for templates? Because I know some of us, one of my good girlfriends, she loves a good old template. She likes to just click and everybody's got the same thing going on. I don't roll like that, but that's how she does. Does it use AI? If you're into all that, does it allow for some transcription of your visits? Does your electronic medical record go into your room? You can click a button, and will it just kind of flow with the conversation and put it into the record? All of those things. And faxing. Can you receive medical records? Can you send medical records out through your EHR? All things to be considered. So I want you to go back and give some retroactive grace to your old system where you work, because they had to decide if the system you used to work with did all those things. It's not easy, but no one said it would be. Pitfalls. Remember, I like to share pitfalls. Pitfall number 1, privacy regulations. Make sure whomever you decide to go with, it keeps privacy. It's not letting anybody with a Wi-Fi, a password, jump right onto your network and see all of that personal protected information. So privacy. Number 2, let's not select a system that requires you to do a bunch of different things. There was one company that came calling in court, and they were promising me the moon, stars, and earth. We can get you lower rates on your credit card processing, like down to like SIPs. And I said, okay, but you know what it required? It required me to take all the patients that were in my system in Elation Health, plug them into this new system, scan the cards and do all of that on that system, or do the reoccurring memberships on their system, and then, kind of cross-reference and go back and forth. I said, no ham, no ma'am, no turkey, not for my team, because remember, I'm not going to undervalue my team. I'm not going to create a bunch of busy work for them where we have to do all of that. And also remember, if I'm at home and I'm not in the office and someone reaches out to me who's a member, or maybe they're not an active member and they're asking me something, I don't want to say, hold on, and I have to log into this system and log into this system. No, thank you. We want cutting edge. We want quick. And pitfall number 3, not checking the credit card disclosure fee agreement. That one cost me big. So I told you that I love Elation. I do. And Elation will collect my payments for me. So for my reoccurring memberships, for my people who are enrolled in DPC, Elation, it's right there. It's the patient's enrolled, Elation collects my membership fee for me, and then if their card declines or whatever, it's right there. Except I didn't read the fine print on the fees. Had I read the fine print, I would have made some adjustments to what I was charging the patient, because for 2.5 years, I paid those fees and had no record or knowledge of what that dollar amount was until one day, I don't know, it was Kismet or something, and I had to nail it down and find out exactly how much am I paying. So I was charging $100 for something, we'd get $93.03. And the rest of that was going off to Elation or Stripe, the processing, credit card processor. Well, we work a little too hard to be giving away that amount several times a day. And so we had to go with, I got an external system. So now it does make it a little bit cumbersome, and it makes it a little bit more challenging for Miss Brenda, who's remote. She can't see what was done in the office swiping, and it makes us have to do double record keeping. But those are pitfalls. Remember, as your fairy godmother, I promise I'd help you not make some of the mistakes that I've made. I'm working on fixing it. Y'all pray for me. So I hope that answers most of your questions, or at least gets those things going, those thoughts about electronic health records. So I'll see you in the next module.